Hey there, welcome to my YouTube channel. Subscribe to my channel and also press this bell icon.
Yeast infection during pregnancy. Yeast infection, also known as vaginal thrush or vaginal candidiasis, is a fungal condition that develops when the yeast present in the vagina. Yeast infections are caused by a tiny fungus called candida. Causes of yeast infection in pregnancy. Number 1. Elevated estrogen levels. Higher levels of estrogen in the body during pregnancy stimulate the production of glycogen by your vagina. Since the yeast feed on glucose, it is convenient for them to grow and multiply. Number 2. Medication and antibiotics. The prescriptive medication taken to kill the targeted bacteria also affects the balance of the protective organisms that live in the vagina, thus allowing the yeast to overgrow. Number 3. High blood sugar. Women with existing diabetic conditions, or those who develop gestational diabetes during pregnancy, have a higher disposition to yeast infections due to weakened immune systems. Number 4. Sexual intercourse. Sexual activity can trigger yeast infections. In cases where the sexual partner has the infection, it can be transmitted to you during intercourse. Number 5. Birth control pills. There is a chance that being on birth control pills before conception can affect your hormonal levels during pregnancy. It causes vaginal secretions, causing an imbalance in the pH levels that promote the growth of yeast. Number 6. Douching. This is the process of intravaginal cleansing using a liquid solution, an activity that is done by many women. Although done for personal hygiene, studies show that douching can increase the chances of vaginal infections. Symptoms of a yeast infection during pregnancy. Leukorrhea is an odorless, white, creamy, or cottage cheese-like vaginal discharge. Depending on the intensity, there may also be swelling along with the burning, reddening, and itching in the labia and vagina. Discomfort or pain during sexual intercourse. Burning sensation when you urinate. Bad odor similar to the smell of yeast from beer or bread. How to diagnose a yeast infection. At the doctor's clinic, a simple vaginal swab is done to get a sample of the vaginal discharge or secretion, which is then analyzed under a microscope. Treatments for a yeast infection. Your doctor will prescribe topical antifungal medicine based on the severity of the illness. Oral drugs are not given since they have been associated with a higher risk of congenital abnormalities like autism in your baby. Natural remedies for a yeast infection. Number 1. Yogurt. Yogurt can be used to restore the balance and control the yeast overgrowth. Unflavored yogurt can be applied vaginally once or twice a day until the symptoms disappear. Number 2. Apple cider vinegar. Dab the affected region with the vinegar and leave it for some time until it dries, and then rinse the area with water. It can also be mixed in bath water as a form of treatment. Number 3. Oregano oil. Oregano oil is an effective treatment for fungal infections. It kills fungus and pathogens. It is also loaded with vitamins and nutrients which strengthen the immune system to fight off infections. Number 4. Coconut oil. Coconut oil can be used as a simple and effective treatment for fungal infections. It can also be mixed with cinnamon oil and applied over the affected area thrice a day to reduce pain or discomfort. Number 5. Cranberry juice. Drinking cranberry juice can be highly beneficial in treating yeast. It is known for its safe ability to treat urinary tract infections and improve the pH balance of the vagina. Preventive measures to avoid a yeast infection while pregnant. Wear loose cotton underwear that allow for air circulation to keep the genital area dry. Avoid using strong-smelling soaps, bubble baths, and sprays in close proximity to the genital area since they might irritate the area and make the issue worse. After engaging in activities like swimming and exercise, be sure to promptly take a shower and completely dry yourself. Avoid spending extended periods of time sitting in wet or damp bathing suits or sweaty workout cloth. Always clean the genital region from front to back. Infection risks rise when wiping back to front. Consume a healthy, balanced diet that is heavy in fruits, vegetables, and whole grains, and avoiding high sugar and fatty foods. Avoid wearing underwear or pajama bottoms during bedtime. Refrain from douching. Complications of yeast infection. Untreated pregnant yeast infections can be quite uncomfortable. Serious complications from other infections or STDs can be misread as yeast infections and thus go unnoticed. This might lead to significant issues for both you and your baby. A yeast infection is a common irritant during pregnancy, although it does not pose a serious health risk. Adopt simple preventive and remedial practices to ensure you reduce the chances of contracting this infection.
Thank you for watching. Subscribe for more.